Examine the neurological system of the horse and summarize the findings. So the steps. Take number one is the history, number two is the physical exam, the vital parameters, and the neurological exam. Number three is the additional diagnostics, and number four is the treatment. So number one, the history. Look at the vaccination for equine herpes virus. Number two, the West Nile fever. Number three, tetanus. See if there's a change in food for like toxicosis, and see when and how often. See if it's regular or irregular. If it's irregular, ask for videos. And how does it look? Are there signs? Are the signs not always there? The neurological exam. Number one, head. Number two, gait and posture. Number three, neck and forelimbs. Number four, trunk and hind limbs. And number five is tail and anus. So number one, the head. Look at the behavior. Is it alert or dull, responsive or non-responsive? Look at the mental status. Is it excited or aggressive? Head posture. Look at the vestibular lesion. Is there head tilt, a cerebral lesion, or a cerebellar lesion? Look at the motion. Is there jerky movements? Is there resting or a tremor? Look at the cranial nerves. So number one is the olfactory. This is for smell, like offer the horse food. Number two is the optic nerve, vision. Go through different obstacles. And number three is the ocular motor nerve. Look at the pupillary light reflex. Look at light in the pupil. Is there a consensual reaction? Is light in one eye? Check the pupil in the other eye. And look at the chiasmatic opticus, the nerve crossings. Number five is the trigeminal nerve. Look at the facial cuteness sensation, put fingers into the nares, look at the palpable reflex, and touch the upper eyelid. Is there blinking? And the corneal reflex and the ability to chew. Number seven is the facial nerve. Look at symmetry and movement. Is there paralysis? Number 8 is the vestibulocochlear. Is there hearing? Is there balance? Give a noise, see if the animal reacts. Walk on uneven ground. Number 9 is the glossopharyngeal nerve for swallowing. Number 10, do the slap test. And number 12, check the tongue. Pull out the tongue and does it pull back in? So, and number 5, look for movability. So offer the horse food. Is there voluntary movements? Go up and down and side to side and see if the horse jams mentally. Look at the gait and posture. Is there ataxia, which means lack of coordination? Hypermetria, which means increased joint movement, which you see in the West Nile virus. Hypometria, which is decreased movements, such as toe dragging. Paresis, which is muscle weakness, and paralysis, which is no muscle voluntary movement. And look at the neck and forelimbs. So the mobility, give it food if it goes up and down, if it bends the neck. Look at the cervical cuteness sensation, squeeze the skin, and the sway reaction, push the withers. And is there a deep pain perception? Look at the correction test, cross the limbs, and the proprioception, and place the hind limbs, and look at the hopping test. And the trunk and hind limbs, is there a cuteness sensation, back palpation, paniculus reflex, and sway reaction? Push the tubercocci, see if the animal goes down. And then is there a deep pain sensation, correction test, hopping test, and go in circles. The hind limb should cross. And the tail and anus, lift the tail and do the perineal reflex. So the localization, is there central nervous signs? If yes, it could be cerebral, cerebellar, or the brainstem. If no, if the hind limb is more than the forelimb, then it's cranial nerve 1 to 7. If the forelimb is more than hind limb, it's cranial nerve 6 to thoracic nerve 1. And if the forelimb is normal and the hind limb is abnormal, it is the lumbar or the thoracic region. And if it's the tail and anus, it's the sacral region. Additional diagnosis, look at myelography, contrast in the subarychinodal space, and this excludes wobbler disease, which is a spinal cord compression. Lab, look at this is to exclude liver and kidney disease. The ELISAs for the West Nile virus, and PCRs for herpes virus. And the cerebral spinal fluid collection. So for the atlanto-occipital joint, you need general anesthetic, and for the lumbosacral joint, you need standing and sedation. So the treatments: fluids, urine catheters, if not urinating, NSAIDs, flunixin, meglumine, low doses of glucocorticoids, diuretics, mannitol. This is to decrease edema, for compression of the spinal cord, to stop that. Vitamins, vitamin B1, these are antioxidants, and recumbency. Turn every 3 hours, this stops the lung damage. And the diseases are the cerebral vertebral malfunction, this is CVM, or the cervical static stenosis, this is thickening of the dorsal lamina of the joint capsule, or the cervical vertebral instability, this is malformation of the articular process, and the head and spinal cord trauma.